Harmless is a user-led service, so we provide support, information, training and consultancy around the issue of self-harm.
Harmless are a social enterprise. They have a specific vision of promoting recovery for people who experience self-harm, and particularly focus on trying to instil hope and be a completely inclusive service which is open to anybody who approaches them, either by self-referral or being referred by other services, both statutory and non-statutory.
They collaborate with NHS services.
They're a national organisation, but I guess I feel that we're lucky that they are based in Nottingham. So they do offer national services like their website and email support, but they also do a lot more for the local community in terms of more direct work.
I think one of the really refreshing things about Harmless in comparison to a lot of statutory services is that they really do meet people who are in a really difficult place in terms of suffering and offer them hope. Because they're all inclusive, it enables people who might find it very difficult to approach statutory services to find a place where they can access a range of services. I think offering that range is really important in terms of things like, for example, offering email contact. That wouldn't be something that would ever be offered in statutory services, which if people are either anxious or reluctant to come and meet somebody face to face, that might be a first step towards getting help.
Harmless was established in 2007. At that time we had a vision of a service that we'd like to create, and since then we've kind of grown in stature and reputation.
I was particularly involved when they started to develop the drop-ins. I was part of a steering group and worked along with Harmless at looking at what services we could set up. So that's one of the things. But before then and since then, we have quite a close working relationship that we meet periodically, look at what they're doing, what we're doing in statutory services in the health service, and I guess try and have more of a holistic view and offer people a range of services for self-harm.
I recommend them because I know it's effective, I know it's a very supportive way of working that they have, while still being able to sort of challenge people in an encouraging way and look at change.
So there's a lot of misconceptions about self-harm, but also about the work that we do. So we face a lot of challenges. We do a lot of work to overcome those misconceptions. We try to raise public awareness, challenge stigma wherever we can, and reach out to people that might feel isolated and that it's hard to get help for.